I'm going to start by saying I'm a doctor. So I see patients, I'm a clinician. And when I was in medical school and I finished, we raised our hands and made that Hippocratic oath that said first to do no harm. And I'm seeing CDC being transformed into a weapon.
Hello, I'm Dr. Ida Brown.
And I'm Dr. Sonia Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond.
So what you just heard isn't just noise. It's a moment of reckoning. We're talking about the leadership of the CDC resigning en masse, not from weariness, but in protest. These are the people who have devoted their entire careers to science, to protecting public health and integrity. And the chief medical officer, heads of immunization and emerging diseases, surveillance experts, they walked away because they could no longer defend what's happening at the agency.
And kudos to them. I mean, these are not just faceless bureaucrats. These are the scientists. These are doctors. These are public servants. And their exit not only sends a chilling message, but if people are most committed to health and the public health of the United States can't stand behind the institution of the CDC, what hope do we have as a community, as the United States, and especially as Black and Brown communities? Because you guys all know that we've always seen the government walk away from us when we really needed them.
So, Dr. Sloan, how did we get here? From trusted science to orchestrated resignations? And it starts with a political pact, one that claimed to safeguard scientific norms, but quickly unraveled. Let's roll the clip.
If Mr. Kennedy is confirmed, I will use my authority as chairman of the Senate Committee with oversight of HHS to rebuff any attempt to remove the public's access to life-saving vaccines without ironclad, causational, scientific evidence that can be accepted and defended before the mainstream scientific community and before Congress. I will watch carefully for any effort to wrongfully sow public fear about vaccines between confusing references of coincidence and anecdote. But my support is built on assurances that this will not have to be a concern, and that he and I can work together to build an agenda to make America healthy again. We need a leader at HHS who will guide President Trump's agenda to make America healthy again. Based on Mr. Kennedy's assurances on vaccines and his platform to positively influence Americans' health, it is my consideration that he will get this done. As I've said, it's been a long, intense process.
So that was Senator Bill Cassidy explaining why he cast the decisive vote to confirm Robert F. Kennedy Jr. as Health and Human Services Secretary. His reason? He said that RFK Jr. reassured him that he would lean on evidence-based science. But really, Dr. Sloan,
what? I mean, I know this was several months ago, but this sort of sets the stage of how we got here, right? That's what we're talking about, is that the irony of it all, that Robert F. Kennedy Jr. built his whole reputation on casting what doubts on vaccines. He even questioned their safety. He amplified the conspiracy theorists all across America. And for decades, he sowed the distrust, the very tools that kept our community safe. But yet at the most pivotal moment in history for Americans, the senator decided to take him at his word, right? Like over decades of consensus from the CDC's own advisory committee of immunization practices, who, by the way, are now gone.
I mean, this is how fragile our system can be, right? Public health policy, something that should be grounded in data and evidence, has come down to a single senator's comfort with political reassurance. I mean, one man's "I'll trust you this time" has outweighed the voices of scientists who have spent their careers protecting lives.
Careers. I mean, consequences are massive at this point. Lives are on the line. And so instead of the CDC driving the conversation for historical prevalence and precedents, politics are now driving everything. And so instead of experts who have done the research and have put the time and the hours and the years in of science guiding what vaccines should be covered, the political theater has now taken over the stage, and we are in for big trouble.
And and here's the bitter truth. And this is something that we've been saying basically during this entire presidency.
Yeah.
When politics replaces science, it isn't just a philosophical debate. This isn't, apples or oranges. It really, this sets the stage for resignations at the top, for confusion in the states, and even financial strain for families who can't afford to pay for vaccines out of pocket.
Yeah, but we know this was all part of the scheme of Project 2025, from Cassidy's decisive vote that didn't just elevate RFK Jr. To the HHS head. It opened the door for the crisis that we're in now, 8 months later, you guys. So I just wonder what he got in return, Dr. Brown, for all of that. Like, what were the backdoor discussions of, you do this, we do that? So, I mean, what people need to see that in a short amount of time, America's health has become on the block. It is for sale. Medicine's no longer about science or research. It's about who goes to the highest bidder, if that's insurance companies, pharmaceutical companies, or anybody else that are maybe oligarchs that are controlling us now. So, yeah.
It's kind of beyond what any medical professional or researcher could have anticipated unfolding in our lifetime.
We never saw that coming. We never saw this coming.
Never. Like, think about measles having been eradicated, and now there's measles outbreaks throughout the country, and we still actually probably don't have all the information on that because we don't have a freaking CDC, right? So it's like, we're here where the CDC is leaderless. Science has been sidelined, research has been halted, and with the pulling of NIH grants, our public health really teeters in the balance. Let's just run this next clip.
We love you all. We will do what it takes now to be on the other side to support public health. There's so much going on right now when you look at the devastation that's happening to our staff, our campus.
You are the people that protect America, and we are going to be your loudest advocates.
I mean, I'm glad the CDC, CNN was there to actually capture that moment, because we know that a lot's being lost in the press right now. And so these were the top officials who resigned their position from the CDC. The agency director, Susan Manarez, was ousted. And so the people that followed her as she was escorted out of the building were cheered. They were cheering, but don't get it twisted. The energy was not to support the political powers that fired her. In fact, the CDC staff gathered and honored each one of those officials as they resigned, applauding them and cheering them as they left the building. I mean, it was a sight to see, to the point, Dr. Brown, let me throw my pettiness in here. I think those outstanding human beings deserve a Nobel Peace Prize, don't you think? Maybe because they could stand up, do what's right for all of us and humans, as human beings in the United States, that maybe someone needs to make a call to the Nobel Peace Committee on their behalf.
Yeah, these folks who were ousted, right, on Thursday, August 28th, 2025, they have names. Deborah Horry, who was the CDC's chief medical officer and deputy director for program and science, and she resigned in protest following the firing of Dr. Susan Monarez. And Horry emphasized that without Monarez, the agency lacked scientific leadership. That's an alarm. Dmitry Daskalakis, he's the director of the National Center for Immunization and Respiratory Diseases, and he stepped down, citing concerns about the politicization of vaccine policy and the appointment of advisors making recommendations before reviewing data, which is counter-science.
Totally.
Daniel Jernigan, who was the director of the National Center for Emerging and Zoonotic Infectious Diseases, he resigned. Jennifer Layden, who was the director of the Office of Public Health Data Surveillance and Technology, which actually includes the National Center for Health Statistics, something it's important for us to be following. Right. She too resigned in the aftermath of Monarez's firing. So these departures, they're not just bureaucratic reshuffling. They are a red alert warning that science has been pushed all the way to the side. And this is all for politics.
But hey, we have to, you got to give these people a standing ovation. When the top CDC officials resign in the middle of a public health storm, really, this is a non-ending nightmare for us right now. But the crowd was there to cheer them on. The crowd was there to support, to say, we believe in you and not the system, and how far we have fallen now from the trust in the United States government and the CDC. So it used to be a source of stability for us. Instead, it's become this symbol of just dysfunction, and it's really the playground for the political tyranny of RFK Jr. and Trump just wielding his power that he has right now. So when the trust collapse at this level, at the top of this national institution, it's not just abstract anymore, because lives are at stake. My family, your family. When 4 people walk out, it speaks volumes to where we are at this point in history, not just for us individually in our health, but also for our country historically.
So well said. I mean, and let's really talk about, yes, there's the national health, but there's a financial impact as well, right?
Yeah,
just with all of this this political fear mongering. And here's the part that rarely makes the headlines, right? Without CDC backing, vaccines don't automatically get covered by insurance or Medicaid. So without a CDC recommendation, states and insurers can say, hey, we're not obligated to cover that. And then suddenly what was once free at the pharmacy now costs hundreds or thousands of dollars. So again, this politicization of science, it's going to hurt people's lives here in the United States.
Just the science, but also our healthcare and healthcare policies. I mean, there's so much going on that we are literally being just blindsided, so we don't even know what is being politically signed and pushed through right now. So the irony of it all is that we are one of the wealthiest countries in the world, right? And healthcare should be about a human right, that if you are sick, you should have the right to be taken care of. How that gets funded with Medicare cuts right now, Medicaid cuts, I'm not sure what's going to unfold, but it's now our healthcare in the United States has become a luxury. It's not about what's right. It's not about human rights anymore. And so for families, especially, working families, poor families who already are trying to decide if they're going to pay rent or if they're going to buy groceries, gas, whatever, they can't afford this bill of healthcare. They just can't. And so the protection that we used to have from preventative care to chronic care and diseases is on the chopping block. And that's what's really scary.
I mean, it's chopped. It's chopped. It's cut. And the people that kind of protect us at the CDC are gone. And, and skip vaccines, they don't just put one individual at risk, right? They put entire communities at risk, because an outbreak doesn't stay confined to a home or a school or a block or even a borough. Again, just thinking about COVID-19. And if, everyone's on the New York City subway together, if someone had it, then someone else is going to catch it. So the implications for this cannot be overstated, right? This leadership vacuum at the CDC, it's translating into wider inequities, right? Wealthier families can absorb the cost, poorer families cannot. And then diseases we thought we left behind, measles, flu, even COVID, now become diseases of poverty all over again, which cost everyone, not just the people who are physically ill. So this is the cost of silence, dysfunction, and politics triumphing over science. Yeah. I'm not here for it.
We're not here for it, but we still have to stand up, right? So we all feel the walls closing in on us, like politics is just about to drown us. We're tired of watching TV and the news and anything that when politics starts drowning out science and when fairness is going to be replaced with fear mongering, you have to remember one thing, that history is always lends itself to the people that speak up. So there's this thing called the 3.5% rule. And it's very clear that 3.5% of people who stand up, who organize, and refuse to be silenced, dictators will actually fall and unjust systems will crack. And so that's when the tide turns. So it's not just opinions. This is fact. This is dedicated decades of research that's been done with this and with different movements across the world. So in this moment of unsureness, of unrest, of despair, of hopelessness, we have to be that 3.5%. Because if we all stand together and we rise up, no amount of political theater can erase what is true or the power of the people. And that's who we are.
So stay informed, stay vigilant, and remember, the truth is our most powerful tool. We are the 3.5%. Thanks for watching. We are Aya, contributors to the Midas Touch Network and proud members of the Midas Mighty. Please subscribe, like, share, and follow for more updates. Thank you, everyone. See you soon.
Want to stay plugged in? Become a subscriber to our Substack at MidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MidasPlus.com.